Hi, this is Stuart Talley, here to do a video today about a recent recall of a prosthetic hip device that's manufactured by Smith & Nephew. There are actually two hips that are implicated in this recall. One is called the SMF hip, and the other one is a REDAPT revision hip. The thing that makes these hips unique is that they are what we call modular hips. If you look at a prosthetic hip, which I have here, there is two major parts to this hip. There's this part and then there's the ball. And this is called the stem, and this is called the neck or the trunnion, and the ball fits on the trunnion. What makes the SMF hips unique is that they're what we call modular hips. So most traditional hips, the trunnion and the stem are one solid piece of metal. But with the SMF hip and the REDAPT hip, they are what we call modular hips, which means that this part is a separate piece of metal from this part. And oftentimes they're made out of different kinds of metal. This will be cobalt and chromium, while this will be made out of titanium. So what the problem is with these hips is that where the neck and the stem meet, right in here, this is called the juncture, there is a reaction occurring between the two pieces of metal. Part of that is caused by what's referred to as micromotion. So you have tiny little motion occurring between the two pieces of metal. And part of it is also caused by the fact that there are two different kinds of metal here, cobalt, chromium, and titanium. And when these metals react, you end up with what's called corrosion. And corrosion causes the leaching of cobalt and chromium into your hip joint. The way to test to see if this is occurring in your hip is to get a blood test, a simple blood test that will tell you if you have elevated cobalt and chromium. Normal cobalt and chromium is 1 part per billion. We have clients that have very high elevated levels, 3, 4, 5 times normal. What can happen with these cobalt and chromium particles that are being released into your hip joint is it can cause soft tissue damage in your hip. It destroys the muscles, the tendons, the nerves, and unfortunately that doesn't always show up on x-rays. So many clients have come to us saying that they were having lots of pain in their hip. The doctor would take an x-ray and attribute it to the individual's back, or say that they have bursitis, or would basically say there was something wrong other than the hip. And then when the person would finally get a blood test, the truth would be revealed and the person would need a revision surgery. Now, the recall notice that Smith & Nephew issued doesn't recommend that anybody with these hips get a blood test. What it says is that if the person is having pain with the hip or problems with the hip, they should get a blood test. But in our experience with other hip cases, is it makes a lot of sense to get the blood test, even if you don't have symptoms, to make sure that your hip is working properly. If there is cobalt and chromium coming off your hip, you need to know. And it's better to know earlier rather than later, because if you wait too long, it could be too late. So if you have one of these hips, we urge you to talk with your doctor, get blood tests, maybe an MRI, to see if there's this soft tissue damage occurring in the hip. If you have any questions about the legal aspects of these hips and what to do if you have one, feel free to give us a call. We have hundreds of hip cases in the firm, various manufacturers, and we have been called by many people who have this type of hip.